start. That can wait. That looks nothing like me.
Hey Mike, how's it going?
Hey, what's going on, boss?
What are you doing right now?
Just doing that charting on Mr. Jones you asked me to.
Oh, okay, so you're charting right now?
Yeah, I'm doing that right now. I think I got 20 more minutes.
20 more minutes? Alright, that sounds good. Don't forget you have your annual performance review at 2 o'clock.
Oh, right, that's today. 2, right? Yeah, I'll be there. Bye.
So next is Michael Freedy.
Mike's a really good nurse. He's really kind-hearted, he thinks critically, but he does a couple of things consistently that are inappropriate.
Like what?
Well, he's supposed to take vitals every 4 hours, but he fails to chart it a lot of the time.
Pulse is good too. Try it again. Right. 75. Try this. Yeah, you're gonna live, buddy.
That's a huge liability issue. Well, charting is a crucial part of client care and communication, and that's something we have to address.
Yeah, I agree with you. It's also come to my attention that when he goes to lunch, he usually doesn't clock out.
Dr. Bailey, I could not get over the look on his face when he saw that patient. That was just ridiculous. You're not gonna clock out? No, man, Chipotle is like a block away.
Well, that's another issue that we're going to have to address.
Yeah. And the last thing that's kind of come to my attention also is that sometimes he doesn't really educate properly.
All right, Mr. Flanagan. About your diabetes medication, what you're doing is we're putting you on a sliding scale, which is going to measure your blood sugar. So you're going to take that after each meal and when you wake up and before you go to bed. This little pamphlet right here will tell you how many units of the medicine you're going to give. You want to clean yourself off with an antiseptic wipe, which will give it to you, and if you don't remember it, all the information's right there, and you have a great day, sir.
What? Hey, I can't read.
Well, I heard some things on the unit that he's actually very capable and efficient, but it sounds like we needed some things to talk to him about.
Yeah, for instance, he's a really good nurse, and then he has great clinical fundamental skills. Alright, so I'm going to start this IV now, okay?
Okay.
Alright, just a little prick, okay? It's not going to be that bad. Oh, man. Sorry, just give me one more second. Got some hard veins. Hey, can I get a hand in here with an IV, please?
Hey, what's up?
Hey, I'm in, but I can't really seem to get a good stick.
All right, hold on, Rob. Can you tighten up the IV or the tourniquet for me real quick?
Yeah.
Thank you. Now, when picking the veins, don't just look for it and feel it, but wipe down to see if you can find any valves because you don't want to run in that because it's just going to blow it. Right here. Take a deep breath for me so you don't feel it. All right, we're all done.
Oh wow, that was easy. Good job.
No problem, man.
And he's also been very helpful in emergency situations in the past. Hey, how's it going, Mr. Flip? Oh my God, I need help! He's not breathing! He's not breathing! Somebody help me! Somebody help!
Calm down, calm down, calm down, get off him. Code blue, room 4.
What do I do?
Compressions, 30, go. You, grab the crash cart. You, call Dr. Willie immediately. It's going to be all right.
All in all, I would say he's an asset to the unit. There are just a couple things that we need to bring to his attention.
That's good.
Long day. Just another life. Hey, Mike, how's it going?
Hey,
How you doing?
I'm doing all right.
Good.
Hello.
Hi, how are you?
Well, obviously, you know you're here for your performance eval.
Yes.
Yep.
Ladies and gentlemen.
We just wanted to start by saying we've heard many positive things about you.
Wonderful, thank you.
Yes, but there's on the other hand, we need to talk to you about some other things.
Okay.
All right.
So, so this is your first annual performance review,
Okay.
and like we said, there's a lot of good things that I personally have seen and heard. I think there are a couple of things that could be done a little bit more professionally. For instance, I've seen you take vitals, you do them accurately and do them well, but I think sometimes you consistently kind of fail to chart them, which is important because we need those for kind of, verification of how the patient is, their status, and then kind of also for their history.
Okay. Yeah, I guess sometimes I just, when the continuity of care and you seem to get used to how a patient's doing and you kind of just like, okay, well, they're stable for now. I'll check on back in them in 30 seconds and it's stuck up here. But yeah, absolutely. That's definitely a liability issue and that's something I should work on. Thank you.
Yeah, obviously you know what you're doing. It's just kind of that remembering. So another thing is it's a little smaller. It's just kind of clocking out during lunch. Just kind of seeing you take off to lunch and just kind of seeing on payroll and stuff that I've been notified that you haven't clocked out on certain days. Which, like I said, isn't that big of a deal, but everyone else is clocking out 15, 30 minutes here, and it kind of adds up. It's not really fair to everyone else. So.
All right. Well, most of the times I just go downstairs or grab the lunch that I've packed and I eat while I'm working. But I can understand it. Also, I think it would be more beneficial if I just actually took my 30 or 45, depending on how long my shift is. And yeah, and I guess I don't want to burn myself out.
Yeah, no, I feel it. Sometimes it's just easier to walk by, but just to bring it to your attention.
Okay.
The last thing was just kind of I walked by earlier, and this hasn't been as consistent, but just something I've noticed was like I walked by earlier and saw that you were on Facebook, and I called you about the review. I was calling anyway, but I called about the review and then asked you what you're doing. You said you were charting. So I understand everyone needs a break, but just if you're on Facebook or anything like that, make sure it's during your break and in the staff room or the break room and just kind of on your time.
All right, I understand.
And also, there was something about education to patients themselves. Education to a patient is very critical for their health and also their discharge. Increasing the education that you give them could be beneficial for your skills and would increase your profession. Again, I've heard many positive things, but I feel like this would increase your skills drastically.
Okay.
So we do this with everyone. It's not an attack on you. Some really good things that I've seen and heard is
Oh yeah, I completely understand. I guess sometimes just straight out of school, the only people you talk to are nursing majors. The only people that teach you are other nurses. You kind of get used to the jargon, so to speak. So I'll work on bringing that back down to the lay level.
Well, good. Well, nothing we really talked about was crazy out of line. There are a lot of things you do really great. I really like you on the team. Everyone seems to really enjoy working with you.
Thank you.
Which is really good. I've seen you in emergency situations, helped out a lot, which is real tough for someone your age. I've seen you bring up people that are also your age and a little younger. And, that's a really important part of our team. So I see you as an asset. And, these are just little things we want you to work on. It's not an attack on you. I just need to reiterate that it's not an attack on you at all. It's just something we do every year with everyone. So. If there's any, I hope it doesn't bother you, but,
Well, no, I'd much rather know where my weaknesses are than to pretend they're not there.
Good. All right, do you have any questions?
No, I think just keep me informed.
All right, I look forward to seeing you on the floor, Mike.
All right, thank you. Bye.
Take it easy. I think that, went pretty well.